Comprehensive NCLEX RN Practice Exam 3. Question 1. A patient with Parkinson's disease has a nursing diagnosis of impaired physical mobility related to neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? A. The NA assists the patient to ambulate to the bathroom and back to bed. B. The NA reminds the patient not to look at his feet when he is walking. C. The NA performs the patient's complete bath and oral care. D. The NA sets up the patient's tray and encourages the patient to feed himself. Patients with Parkinson's should be encouraged to perform as much self-care as possible to maintain independence and mobility. Doing everything for the patient, complete bath, promotes dependence. Question 2. The nurse is preparing to discharge a patient with chronic low back pain. Which statement by the patient indicates that additional teaching is necessary? A. I will avoid exercise because the pain gets worse. B. I will use heat or ice to help control the pain. C. I will not wear high-heeled shoes at home or work. D. I will purchase a firm mattress to replace my old one. Movement and specifically tailored exercises are usually beneficial for chronic low back pain. Complete avoidance of exercise can lead to muscle weakness and worsening of the condition. Question 3. A patient with a spinal cord injury, SI, complains about a severe throbbing headache that suddenly started a short time ago. Assessment of the patient reveals increased blood pressure, 168/94, and decreased heart rate, 48/minute, diaphoresis, and flushing of the face and neck. What action should you take first? A. Administer the ordered acetaminophen, Tylenol. B. Check the Foley tubing for kinks or obstruction. C. Adjust the temperature in the patient's room. D. Notify the physician about the change in status. These are classic signs of autonomic dysreflexia. The priority is to identify and remove the noxious stimulus, most commonly a distended bladder caused by a kinked or obstructed catheter. Question 4. Which patient should you, as charge nurse, assign to a new graduate RN who is orienting to the neurologic unit? A. A 28-year-old newly admitted patient with spinal cord injury. B. A 67-year-old patient with stroke 3 days ago and left-sided weakness. C. An 85-year-old dementia patient to be transferred to long-term care today. D. A 54-year-old patient with Parkinson's who needs assistance with bathing. A patient who is 3 days post-stroke and stable is the most appropriate assignment for a new graduate. New SIs are too unstable, and discharge/transfer paperwork, dementia patient, can be complex. Question 5. A patient with a spinal cord injury at level C3-4 is being cared for in the ED. What is the priority assessment? A. Determine the level at which the patient has intact sensation. B. Assess the level at which the patient has retained mobility. C. Check blood pressure and pulse for signs of spinal shock. D. Monitor respiratory effort and oxygen saturation level. C3-C4 injuries affect the phrenic nerve which controls the diaphragm. Respiratory failure is the most immediate life-threatening risk for these patients. Question 6. You are pulled from the ED to the neurologic floor. Which action should you delegate to the nursing assistant when providing nursing care for a patient with SI? A. Assess the patient's respiratory status every 4 hours. B. Take the patient's vital signs and record them every 4 hours. C. Monitor nutritional status including calorie counts. D. Have the patient turn, cough, and deep breathe every 3 hours. Vital signs are within the scope of practice for a nursing assistant. Assessment and teaching, turning/coughing instructions, must be done by the nurse. Question 7. You are helping the patient with NCI to establish a bladder retraining program. What strategies may stimulate the patient to void? Select all that apply. A. Stroke the patient's inner thigh. B. Pull on the patient's pubic hair. C. Initiate intermittent straight catheterization. D. Pour warm water over the perineum. Sensory triggers such as stroking the thigh, pulling pubic hair, or using warm water can stimulate the voiding reflex in certain SI patients. Intermittent catheterization is a management tool, not a stimulation strategy. Question 8. The patient with a cervical sigh has been placed in fixed skeletal traction with a halo fixation device. When caring for this patient, the nurse may delegate which action, S, to the LPN/LVN? Select all that apply. A. Check the patient's skin for pressure from the device. B. Assess the patient's neurologic status for changes. C. Observe the halo insertion sites for signs of infection. D. Clean the halo insertion sites with hydrogen peroxide. LPNs can perform skin checks and provide site care, cleaning. Initial assessment of neurologic status and assessing for infection signs are RN responsibilities. Question 9. You are preparing a nursing care plan for the patient with PSI, including the nursing diagnosis impaired physical mobility and self-care deficit. The patient tells you, "I don't know why we're doing all this. My life's over." What additional nursing diagnosis takes priority based on this statement? A. Risk for injury related to altered mobility. B. Imbalanced nutrition, less than body requirements. C. Impaired adjustment to spinal cord injury. D. Poor body image related to immobilization. The patient's statement indicates a failure to cope with the life-changing nature of the injury, making impaired adjustment the priority psychological diagnosis. Question 10. Which patient should be assigned to the traveling nurse, new to neurologic nursing care, who has been in the neurologic unit for 1 week? A. A 34-year-old patient newly diagnosed with multiple sclerosis, MS. B. A 68-year-old patient with chronic amyotrophic lateral sclerosis, ALS. C. A 56-year-old patient with Guillain-Barré syndrome, GBS, in respiratory distress. D. K 25-year-old patient admitted with CA-level spinal cord injury, PSI. The patient with chronic ALS is the most stable and predictable of the options. New diagnoses, respiratory distress, GBS, and new PSIs require more specialized neuro expertise. Question 11. The patient with multiple sclerosis tells the nursing assistant that after physical therapy she is too tired to take a bath. What is your priority nursing diagnosis at this time? A. Fatigue related to disease state. B. Activity intolerance due to generalized weakness. C. Impaired physical mobility related to neuromuscular impairment. D. Self-care deficit related to fatigue and neuromuscular weakness. Fatigue is a primary and often debilitating symptom of multiple sclerosis. The patient's statement specifically identifies being too tired as the barrier to care. Question 12. The LPN/LVN, under your supervision, is providing nursing care for a patient with GBS. What observation would you instruct the LPN/LVN to report immediately? A. Complaints of numbness and tingling. B. Facial weakness and difficulty speaking. C. A rapid heart rate of 102 beats per minute. D. Shallow respirations and decreased breath sounds. In Guillain-Barré syndrome, ascending paralysis can reach the diaphragm. Shallow respirations indicate impending respiratory failure and require immediate intervention. Question 13. The nursing assistant reports to you, the RN, that the patient with myasthenia gravis, MG, has an elevated temperature, 102.20 F or 39 degrees C, heart rate of 120/minute, rise in blood pressure, 158/94, and was incontinent of urine and stool. What is your best first action at this time? A. Administer an acetaminophen suppository. B. Notify the physician immediately. C. Recheck vital signs in 1 hour. D. Reschedule patient's physical therapy session. These signs may indicate a myasthenic crisis or a cholinergic crisis, both of which are medical emergencies. The physician must be notified immediately. Question 14. You are providing care for a patient with an acute hemorrhage stroke. The patient's husband has been reading a lot about strokes and asks why his wife did not receive alteplase. What is your best response? A. Your wife was not admitted within the time frame that alteplase is usually given. B. This drug is used primarily for patients who experience an acute heart attack. C. Alteplase dissolves clots and may cause more bleeding into your wife's brain. D. Your wife had gallbladder surgery just 6 months ago and this prevents the use of alteplase. Alteplase is a thrombolytic, clot buster. In a hemorrhagic stroke, the problem is active bleeding, not a clot. Giving Alteplase would worsen the hemorrhage. Question 15. You are supervising a senior nursing student who is caring for a patient with a right hemisphere stroke. Which action by the student nurse requires that you intervene? A. The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. B. The student moves the patient's tray to the right side of her overbed tray. C. The student assists the patient with passive range of motion (ROM) exercises. D. The student combs the left side of the patient's hair when the patient combs only the right side. Right hemisphere strokes often result in left-sided neglect. To encourage the patient to scan and acknowledge the left side, items should eventually be placed where the patient must search for them, or the neglect addressed directly. Question 16. Which of the following arteries primarily feeds the anterior wall of the heart? A. Circumflex artery. B. Internal mammary artery. C. Left anterior descending artery. D. Right coronary artery. The left anterior descending (LAD) artery supplies blood to the front, anterior, part of the heart and the septum. Question 17. When do coronary arteries primarily receive blood flow? A. During inspiration. B. During diastole. C. During expiration. D. During systole. Unlike other arteries, the coronary arteries receive the majority of their blood flow during diastole, when the heart muscle is relaxed and the aortic valve is closed. Question 18. Which of the following illnesses is the leading cause of death in the U.S.? A. Cancer. B. Coronary artery disease. C. Liver failure. D. Renal failure. Coronary artery disease, heart disease, remains the leading cause of death for both men and women in the United States. Question 19. Which of the following conditions most commonly results in CAD? A. Atherosclerosis. B. DMC. D. Renal failure. Atherosclerosis, the buildup of fats and cholesterol in the artery walls, is the primary underlying cause of coronary artery disease. Question 20. Atherosclerosis impedes coronary blood flow by which of the following mechanisms? A. Plaques obstruct the vein. B. Plaques obstruct the artery. C. Blood clots form outside the vessel wall. D. Hardened vessels dilate to allow the blood to flow through. In atherosclerosis, plaques form on the inner lining of the arteries, narrowing the lumen and obstructing blood flow to the myocardium. Question 21. Which of the following risk factors for coronary artery disease cannot be corrected? A. Cigarette smoking. B. DM. C. Heredity. D. HPN. Heredity, genetics, age, and biological sex are non-modifiable risk factors for CAD. Smoking, hypertension, and diabetes can be managed or corrected. Question 22. Exceeding which of the following serum cholesterol levels significantly increases the risk of coronary artery disease? A. 100 mg/dL. 150 mg/dL. 175 mg/dL. 200 mg/dL. A total cholesterol level above 200 mg/dL is generally considered high and is associated with an increased risk of developing CAD. Question 23. Which of the following actions is the first priority care for a client exhibiting signs and symptoms of coronary artery disease? A. Decrease anxiety. B. Enhance myocardial oxygenation. C. Administer sublingual nitroglycerin. D. Educate the client about his symptoms. The physiological priority in suspected CAD/ischemia is to increase the supply of oxygen to the heart muscle to prevent tissue damage, infarction. Question 24. Medical treatment of coronary artery disease includes which of the following procedures? A. Cardiac catheterization. B. Coronary artery bypass surgery. C. Oral medication administration. D. Percutaneous transluminal coronary angioplasty. Oral medication administration is considered medical management. Catheterization is diagnostic, and bypass/angioplasty are surgical or procedural interventions. Question 25. Prolonged occlusion of the right coronary artery produces an infarction in which of the following areas of the heart? A. Anterior. B. Apical. C. Inferior. D. Lateral. The right coronary artery, RCA, typically supplies the inferior wall of the left ventricle. Question 26. Which of the following is the most common symptom of myocardial infarction? A. Chest pain. B. Dyspnea. C. Edema. D. Palpitations. Severe, crushing chest pain is the most common and classic symptom reported during a myocardial infarction. Question 27. Which of the following landmarks is the correct one for obtaining an apical pulse? A. Left intercostal space, mid-axillary line. B. Left fifth intercostal space, mid-clavicular line. C. Left second intercostal space, mid-clavicular line. D. Left seventh intercostal space, mid-clavicular line. The apex of the heart is typically located at the fifth intercostal space at the mid-clavicular line. Question 28. Which of the following systems is the most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? A. Cardiac. B. Gastrointestinal. C. Musculoskeletal. D. Pulmonary. Pleuritic pain, sharp, knife-like, and worsened by breathing or coughing, is most commonly associated with pulmonary issues like pleurisy or pneumonia. Question 29. A murmur is heard at the second left intercostal space along the left sternal border. Which valve area is this? A. Aortic. B. Mitral. C. Pulmonic. D. Tricuspid. The second intercostal space at the left sternal border is the traditional site for auscultating the pulmonic valve. Question 30. Which of the following blood tests is most indicative of cardiac damage? A. Lactate dehydrogenase. B. Complete blood count. C. Troponin I. D. Creatine kinase. Troponin I is highly specific to cardiac muscle and is the preferred biomarker for diagnosing myocardial injury.